Well, hello again. It's Bruce Williams, and today I want to present the fourth lecture in my series on the selected gross pathology of North American mammals. And we're going to talk about some fungal diseases. Not a lot of new ones here that we haven't talked about either in the first lecture on the marine mammals or that we haven't talked about in other lectures on domestic species. But there's at least one at the end that's quite important that we haven't covered yet. But before I do that, I want to thank all my friends and colleagues who provided me these fantastic images over the years, which allow me to put these lectures together. Now remember, when we talk about fungi, they generally are divided into two very broad groups. You have the dimorphic fungi, which are often able to infect able-bodied immunocompetent animals. They do prefer immunosuppressed animals, but you can see them infect normal healthy animals. The other ones are the opportunists, which you almost never see unless the animal is previously immunosuppressed, and both of those groups are represented in diseases in North American mammals. Here we're looking at a fantastic picture of the pluck. Of those unfamiliar with that particular term, it generally means the trachea, heart, and lungs from an animal taken out unblocked. So this is the pluck from a coyote, and there are actually two individual disease processes going on. One is one that we're going to talk about in a fairly lengthy lecture coming up on helminth diseases of North American mammals, and this is a large heartworm. But what I want you to focus on are these nodules throughout all of the lung lobes. And this is infection by a dimorphic fungus. You would have to either look at it under the microscope or know where the animal is from to have a good guess as to which one it is. It could be any of the four common ones, which are Blastomyces dermatitidis, Coccidiomyces immitis or Posidacea, Histoplasma capsulatum, or Cryptococcus neoformans. In this particular case, this is Blastomyces dermatitidis. And fungal diseases like this are at least histo and blasto, are more common than they were in the past as the range of coyotes and other wild animals is expanding into more urban areas. And Blastomyces has a particular distribution primarily within the river valleys of the Midwestern United States. And as coyotes spread their range east, and we actually have them here in Washington, D.C., because I've seen them, you tend to see more commonly these fungal diseases. They would pick it up like any other canid by inhaling the mycelium of the sexual phase of Blastomyces. When the yeast gets into tissues, it almost always is a respiratory form, and from there, as it gains access to the bloodstream, it can go infect a number of other organs, and you will often see it in the skin and the bones and various visceral organs. The morphologic diagnosis would be multifocal to coalescing pyogranulomatous pneumonia. I tend to default to pyogranulomatous whenever I am thinking about one of the dimorphic fungi. If you looked at this under the microscope, you would see that these fairly large budding yeast will be surrounded by a rim of neutrophils and then within a poorly formed granuloma. So I like pyogranulomatous. If you said granulomatous, I'd be perfectly fine with that. But really, in reality, you can't tell exactly which one this is. So I would, if I was put this on a test, I would take any of those as a correct answer. Okay, I'm cheating a little bit here because this is not a true North American mammal, but this is an alpaca. And we see so many camelids now in the United States in various diagnostic labs. They were incredibly popular about 20 or 25 years ago, and they thought that this was going to be the next big livestock market. Didn't really turn out, but people are very fond of having them. And once again, we're looking at these multiple, often coalescing pyogranulomas throughout all lung lobes. The anterior lung lobes appear atelectatic. They seem to be a little bit heavier, more heavily affected, but it's certainly within the entire lung. This one turns out to be coccidiomycosis, or Coccidioides immitis, or posidacea, which started out as a fungus which was concentrated in the more arid parts of California. It started out being called San Joaquin Valley fever, and it has spread over the last several decades to encompass much of the arid parts of the west coast of the U.S., California, down through Mexico, even into areas of Texas and Central America. So the range of this particular fungal agent is increasing. The mycelial spores, they are spread on the winds. They get into the dust, and especially areas where you have a highway, it allows these to be aerosolized. So that's why the range is expanding, and now you can see this infection in many different species, including people. So it's on the rise. People are tested serologically for it after they've had respiratory issues. So coccidioides, but if you put any of the other ones down, that will be fine. There's probably an alpaca that came from one of the western states. We also mentioned this when we talk about marine mammals. It is not uncommon as a fungal agent which may go systemic in sea otters and sea lions and other animals off of the California coast. So really has a diverse species that are affected by this fungus now. So multifocal coalescing pyogranulomatous pneumonia, well, once again, would be a great morphologic diagnosis. So these are fungi that are able to infect immunocompetent animals. Then we need to look at some of the fungi that you will see in immunosuppressed animals, and this is the maxilla of a mountain lion, or a cougar, or a puma, whatever term you prefer. And on the palate, you can see these whitish plaques, which probably also incorporated the tongue and maybe down into the esophagus. And this is what you see in immunosuppressed animals, or animals that have been on antibiotics for a long time. And this is candidiasis, or thrush. Candida is an opportunist yeast, or I should say an opportunist fungus, Candida albicans, and a number of other species, which generally are normal commensals of the oral cavity and the external parts of the reproductive tract. And it's always there, and it's just sort of waiting for its ability to flourish, which it can do in an immunosuppressed host, or it can do in an animal that has its bacterial flora altered significantly. And Candida at that point will invade the stratified squamous epithelium. It will form pseudohyphae. The yeast form is always there. It's environmental hardy. It lives for a long time, and it easily survives within the mixed bacterial flora of the oral cavity. When it gets a foothold, it begins to turn into other forms. The pseudohyphal form, which is really good for scavenging nutrients, and ultimately, in the proper environments, it can fully form hyphae in some species. The areas of candidal growth will become first hyperkeratotic, and then they will become ulcerated or necrotic, which allows Candida at this point to get into the blood vessels, and the yeast forms will travel around the body, and they can set up shop. And what starts out as an oral infection can, in the proper immunosuppressed host, become a systemic infection. So if you see something that looks like yeast in the liver, or in the spleen, or in any of the parts of the gut further on, or urinary tract, Don't rule out Candida albicans because you normally think of it as a mouth pathogen because systemic infections are often life-threatening in immunosuppressed hosts. So that is the story of Candida, and let's move on. Another opportunistic fungus that we will see in our domestic species as well as more wild species such as this antelope is mycotic pneumonia. Mycotic pneumonia is well known in horses to become systemic after significant gastrointestinal disease. It's been correlated with pneumonia. Animals with a ulcerated GI tract with salmonella in the horse and with ruminal ulcers in ruminants can allow Aspergillus, which normally lives there and thrives in desperate times in those GI tracts, usually ruminal acidosis in ruminants or cases of salmonella in horses. It allows access to Aspergillus from the gut to get into the bloodstream, and it often will end up in the lung where the hyphal structures will result in thrombosis of pulmonary vessels, both small and large, infarction, and areas of hemorrhage and necrosis. These are multifocal. They are distributed throughout all of the lungs. Sometimes they will have a fairly targetoid appearance. So knowing that this is Aspergillus, probably fumigatus, or one of the others in the lung of an antelope, we can intuit that this animal might have had ruminal acidosis at one point in previous history. Remember that when you get ruminal acidosis, you don't immediately have all of the wonderful lesions that you see resulting from bacterial and fungal infections. These are usually sequelae that take place over days to weeks after the initial insult, which the animal has survived. Unfortunately, this particular animal did not survive this. Now, there is a condition, here's a wonderful picture by Dr. Peg Miller of Aspergillus in largely farmed elk. It's an elk thing, it's in farmed elk, and it has been described as Aspergillus pneumonia, where you have these large areas of necrosis and suppuration, and the animals generally tolerate this for a period of time, and they will develop hyperostosis of the bone of the legs due to the presence of these areas of space-occupying inflammation. That's a great term that I'm stealing from Paul Stromberg. We talk about space-occupying neoplasms or masses. These are foci of space-occupying inflammation, and they, for the same largely unknown reasons, will cause hypertrophic osteopathy of the bones of the legs. And this syndrome of Aspergillus and periosteal new bone growth of the legs is well known in elk. So that's a good one, and something that I didn't know that much about before. Ringworm. Sure, ringworm. Dermatophytosis, if you like, which incorporates all of the many species. These are usually superficial infections in North American wildlife, as we see here in this porcupine. And so this porcupine, remember that the dermatophytes will infect the follicles. They are keratophilic, so they go after the keratin layers of the developing hairs, and in this particular case, the spines as well of the porcupines. They weaken these hairs or spines, and they break off. If the infection is not contained or there's a significant body response to it, then you may actually have rupture of the follicle and furunculosis. But this is a pretty good case in an unusual species. I don't have a lot of porcupines in my collection, but this is one that had, here's the little ears up here, and this is one. This is all. You can see that the skin is very scaly. There is alopecia and loss of spines. That's got to be pretty bad for this little porky's self-esteem. So dermatophytosis, hey, any North American mammal can get it, and they do, probably on a fairly regular basis. I don't think that I would particularly ask for a species on this, on a lot of these, because they're out in the wild. Are probably the geophilic forms, Trichophysin gypsum, or those that can live in the soil, do not necessarily have to be gotten from another host, but I guess you're just going to have to culture all these and figure it out. So dermatophytosis, and here we are in a polar bear, also dermatophytosis, a focal area of hyperkeratosis and alopecia because those hair shafts are broken off. You know, as the more dermatopathology I do, at least the gross dermatopathology, hyperkeratosis is a word that I use over and over and over again. So many derm lesions are beautiful under the microscope, but grossly they all end up as either a crust or a rash. Papular dermatitis or hyperkeratotic dermatitis. So if you are looking at and learning gross pathology of the skin, you're going to use hyperkeratotic dermatitis quite a lot, and probably dermatophytosis is the prototypical hyperkeratotic dermatitis. Okay, now I said that I was going to introduce you to one fungus before we're done, and our last fungal disease to talk about is one that is we're all very concerned about. And I gave you a little hint at the beginning of this lecture because I had a picture of a bat on it. And this is a fungal disease that has appeared on the scene within the last 20 years. There's some conjecture that it might have come from Europe or Asia and infected the naive American bat population, but it's caused some massive die-offs of bats, and it continues to march across the United States. This particular bat has this white fungus which is present on its muzzle, around its mouth, and probably on the skin of the wings as well. And this goes by the name of white nose disease. The fungus goes by the name of Pseudogymnascus destruens, and it used to be Geomyces destruens, but that has changed. But this is a fairly long-lived fungus that survives very nicely in the deposition of guano and soil in the bottom of the hibernacula of the caves that the bats live in. The distribution, this is not a systemic internal distribution. It largely is confined to the skin of the animal in this particular distribution. And as such, the animals do not have to be immunosuppressed, and you can see large outbreaks in caves with large amounts of bats. The actual disease is seen much more in the cold winter months where it does its damage, and animals that survive may show little to no active infection in the warmer summer months. And the problem that this particular fungus causes is that bats will hibernate. They go into a torpor during the winter months. They're very quiet, and they utilize their fat stores during hibernation. And one of the keys is that they're not very active. And then the animals that are infected with this cutaneous fungus do not hibernate properly. They are very active. Their body rate can be twice as much as their unaffected neighbors. They may actually wake up and go out to seek food in winter months where insects aren't even available, and they use up their fat stores and energy. The other thing that it does is, depending on the amount of skin that is covered, we've talked about how diffuse infections of the skin are not benign, in that these animals, depending on how much of the skin is covered by the fungus, will lose water in an insensible way because they're not drinking any, and it just leaks out through the skin, resulting in electrolyte disturbances. So it's not a fungus that, by virtue of vasculitis or anything else, kills these animals, but it renders them very susceptible to the ravages of winter when they should be sleeping and conserving their fat stores. So that's probably a gross oversimplification of a very complex disease. I think that in active infections, the appearance is almost diagnostic. This will fluoresce under ultraviolet light, giving off sort of an orange color. And in animals in the summertime, whereas they might not manifest with this fuzzy white fungus, at that moment you can see areas of sort of pallor or blanching in the wings, which will clue you in that this animal has been infected in the past. So it is a severe disease, obviously of great concern, and something that I know that a lot of scientists are scrambling right now to find a treatment for. So, white nose syndrome of bats. And this brings us to the end of this particular lecture. And thankfully, it's not as long as my usual ones. So with that, I've got another short one coming up. The next one's going to be on protozoal diseases. So it's a pretty short one. Hopefully you can knock both of those out today. And with that, I, as always, will wish you good health, good luck, great happiness, and I appeal to you to stay safe. And I'll see you next time.